Hey guys, it's Frida with Empower Academy of Phlebotomy. And today what we're going to go over is patient identifying. This is so important because if you do not identify the patient in the correct way, then it can be so bad. You literally can lose your job for it because you have to identify your patient in order to make sure that that patient and the identification match what you're going to draw. That means that the labs are for the right person. So today, that's what we're going to learn. So we're just going to do a quick review and just go over the identifiers and if we had a scenario, how you would handle it and what you are supposed to do. So let's begin. Patient identifying. You have to identify the patient with two identifiers. The first one being the first and the last name, and also the date of birth. This is so important, guys. Identifying, I'm going to say it again, identifying the patient, especially with the order versus if you have it in hand or in your system. It is so important because if you get a patient's identification mixed up with another person, just look at it this way. You are misdiagnosing the patient. You cannot misdiagnose. You have to follow the proper protocol. All right, so some additional questions that you can ask the patient is, are you fasting? Why do we want to ask them, are you fasting? Because some of the tests require fasting and a doctor's authorization to proceed without fasting. You have tests like, especially like for example, your lipid panel. Your lipid panel does require for you because it's testing your cholesterol. So it does require for you to fast. Even if you have a patient who say, no, I don't want to fast, and you have to understand it is up to the patient if they want to proceed with the testing or not. However, that order is in your hands. So if a patient refuses to fast, then you say, okay, excuse me, and you go and you talk to either the medical assistant, the nurse, or the doctor. This patient does not want to be fasting with this test. They want to proceed without fasting, and let them give you the verbal authorization to move on. All right, another question is, are you taking blood thinners? This is so important for aftercare, especially for the patients that is taking blood thinners. The reason why is if they take off that wrapping immediately after you do their blood draw, then they can move the wrong way, pick up something the wrong way, look down, and they have blood running all down their arms. So I feel like whenever you ask a patient this and you tell them, hey, you're on blood thinners, keep this on for at least 30 minutes, watch this area and be very, safe with your arm, then that gives them instructions to keep it on for 30 minutes, okay? Can we go ahead and begin? This is so important because this is a verbal consent from the patient that you can proceed with your blood draw, okay? So now let's go over here really quick. I'm gonna move the camera over so you guys can see. All right. So what I did was I wrote out a scenario in this scenario, and I also will do another video on versus if you worked in a PSC or IOP or something like that, which is an in-office patient setting. But today we're gonna work on if you was in a hospital setting with a patient that was in the hospital, okay? So what you would do, I'm gonna move back over here, sorry. We're gonna do a scenario with a patient in the hospital setting. So what you'll do is you'll knock on the door and you'll enter the patient's room. Hey, Mr. James. You're gonna introduce yourself, okay? So knock, knock. Hey, Mr. James. My name is Frida. I will be your phlebotomist today. What am I going to do? I am here to draw bloods for your labs. Then you're gonna identify the patient. Remember, two identifiers. First and last name and date of birth. Then, are you fasting? Which means that they have not had anything to eat or drink for 8 to 12 hours. Are you on blood thinners? Say Mr. James said no. Okay, well just keep this on for about 10 or 15 minutes. Say Mr. James says yes. Keep the wrap on for 30 minutes or more. Make sure you keep your eyes on this area and be gentle with your arm. Then you're gonna come down. Can we go ahead on and begin? Remember, that is a verbal consent, okay? So I'm gonna give you another rundown, okay? Enter the room. Hey, Mr. James, my name is Frida. I will be your phlebotomist today. I'm here to draw your blood for your labs. You can either, what is your name? What is your first name? What is your last name? What is your date of birth, okay? Are you fasting? You don't have to say for, just are you fasting? Are you taking blood thinners? Can we go ahead on and begin? It's just that easy, guys. You have to identify your patient, and you have to make sure that the patient's identification that you have on that order or in your system match the person that you have in front of you. That is the key important. That is the number one thing, and it is so important, okay? So thank you for tuning in. Thank you for watching this video. And if you have any questions, you can always DM me. Like I said, I will come back on here and make another video for the ads with another scenario. Thank you, guys. Have a blessed day.